So this morning or evening for Paul, I'm joined by Paul Schmitz, who is in Milwaukee in Wisconsin. And I'm just going to hand over to you, Paul, to introduce yourself. Can you just say a little bit about what you do?
Sure. My name is Paul Schmitz. I serve as Senior Advisor to the Collective Impact Forum and also have my own consulting business called Leading Inside Out. I'm headquartered in Milwaukee, Wisconsin, which is near Chicago, and work around the country and sometimes globally, working on helping build leadership strategy and culture for collective impact efforts. I've done 3 tours through Australia and truly loved and enjoyed all my time with folks like Collaboration for Impact and some of the other groups I've worked with, and exciting to talk to you all even virtually.
It might be a while before we have you back as well. So let's talk about that. We're interested in exploring your observations about how people have taken up collaboration or to respond to what's happening with COVID, and obviously the civil rights issues which are emerging really strongly in the US. So could you just say a little bit about what are you seeing from your vantage point?
So I think one of the things is that those communities where there were functioning collective impact or collaborative efforts have been kind of redeployed around the emergency response at various ways and at various levels. If I take my city, Milwaukee is a city of about 600,000 people in a county just over 1 million. Right now we have over 11,000 COVID cases. We've had over 350 deaths. And our rate's actually flat right now. We've bent the curve and we've been holding down. So that's considered a good number. And if you think of that per capita, it's way more than Australia by magnitudes. In early March, our mayor got on the phone with the head of the community foundation as they were seeing this coming and said, what do we do? And they decided that they would form 6 and then 7 collective impact teams. And some of those were existing collective impacts that got repurposed. Some of them were rebuilt. Our Cradle Career Initiative in Milwaukee, which focuses on obviously K-12 primarily, their staff are now facilitating these 7 groups that have only 2 of which have anything to do with their normal work. And these groups have all been doing an emergency response effort that has focused both on meeting immediate needs, but also system change. So for example, they got a former convent to open as an emergency housing for COVID-infected homeless people, but also been working on using waivers from federal funds right now to put more people into permanent housing, which is systems change. And so there's a lot of work happening at both levels, but they've moved an immense amount of work in a couple months and now actually have built logic models for the next year. And again, none of this is anyone's mission or current work or current goals, but their work is being dictated by the collective response to the emergency in areas like mental health and physical health and food and shelter and early childhood, childcare, K-12 education and economic recovery.
And so obviously COVID's been a big disruptor for that and triggered the response, but what have been the conditions in place which have enabled that really fast pivot?
Well, I think part of it is that there were existing relationships because people had been collaborating and working together. And then I think you had facilitators and others who were skilled from having done a lot of facilitation in this space, who were able to bring tools and ways of working with each other and able to do that in a way that made a lot of sense. And so I think those ingredients really helped. I think funders came in as partners. And so in this case, in my community, each of the 7 groups has a philanthropy chair and a field chair, and they're working together. And as their team is coming up with solutions, the philanthropy chair's job is to work with the network of philanthropists who've come together on this to figure out how to deploy the resources. In fact, our local funders, including our community foundation, our United Way private foundations in our city, are sharing literally one Google spreadsheet where requests for money are being put, and they're collaborating together to figure out how to deploy resources across the funders to those needs. Something that's, that if you told me 4 months ago funders would collaborate like that, I would have told you crazy. And the funders are in the trenches with the groups and figuring out how to help them solve problems. And so the United Way funded putting dividers in a private taxi company's taxis to transport homeless people to emergency health shelters. The United Way just ordered over 1,000 infrared thermometer for childcare centers. This is not nowhere in anyone's strategy or plans, but it's being responsive in a partnering way. And I would say the other big thing we're seeing is that everyone's saying the sense of urgency is bypassing the petty, that these groups, by nature of the need and what needs to happen, no one's wordsmithing, no one's doing the holding their turf, and if they are, no one's patient with it. That the level of collaboration and trust generated is very high by necessity, and people aren't playing games or kind of getting involved with things. They're very action oriented. And so that's been kind of interesting, the way that these groups I've talked to in other cities. I'm right now have clients in Los Angeles and Chattanooga, Tennessee, and Pittsburgh, Pennsylvania, and Milwaukee and Chicago and other cities. And what I'm hearing from all of them is just that the usual BS, there's no room for it. Everyone's just very focused on getting things done.
So, you know, we often talk about that. People are really good in crisis in Australia. It's a constant dynamic with the bushfires and whatever, that people also in authority know how to respond to that, usually. So I guess the question that we're grappling with here is, for change makers and people doing the kind of work that we're involved in, how do we leverage this and stay kind of focused then on that systems change in the work? So I'm interested in, how have you been doing that? What shifted for you in your practice through this? And, you know, what's been your key learning as a change maker?
Yeah, so two tools we started working with groups right away on was something called strategy triage that my colleague Mari Nurkia created, and also using kind of quick scenario planning tools. And the strategy triage was kind of simple. It was like, look at your current strategy and goals for the next 12 to 18 months, because we know our disruption is going to last at least that long. What remains a priority and you know you're going to do no matter what? What gets paused until you reach a certain point, and what conditions would you restart it? What do you just stop and know, like, that's not going to start again until things return to a new, you know, a different normal? And what do we need to know in order to move other things? And then what's new? What newly do we have to focus on that wasn't in our strategy and work before? And I was talking to a client today about the fact that we did that back in April based on what we know now. And I'm like, you need to do it again now that we're past the emergency response period, which was about a 3-month period. And we're in kind of a new normal, which is still going to be chaotic and disruptive for at least a year. I was sharing with you earlier, I mean, we don't even know in 6 weeks when the schools open, how they're going to open. We're hearing there's different options, and we still don't even know whether kids are going to be in school in 6 weeks.
Yeah.
And so there's a lot of disruption still. And we've got to think about, in this new normal, like, how has that shifted and how do we have to think differently? So a lot of education area groups, for example, are focused on digital access and literacy, because there's no scenario in most communities where kids aren't going to be virtual learning for at least a portion of their education. And then what does that mean for instruction and learning, and what best practices and tools and teacher trainings needed? And so if you were working on 3rd grade reading as your collective impact, you're now focused on digital literacy and access, and you're focused on instruction and learning in an online environment, and figuring out how to prepare schools with all the PPE and cleaning supplies they'll need to be able to open. And so, and how to support parent engagement around that. And so that, and then the scenario planning, just being able to look and say, based on different factors of how things might be, what do we need to do? And I should mention that at the Collective Impact Forum, we posted a tool on that, and also linked to some other examples of tools others have created, including that strategy triage.
Right, we can share that link. So
Great.
Just finally, Paul, so what's giving you hope through this?
Well, the most hope I have right now is from the marching, is that the civil rights marches that are happening over police brutality, and really over overall kind of racist policies in our communities and country, is giving me a lot of hope right now. It's young people primarily, which is wonderful. I've been out there. It's been incredible. And the and policies and things are changing. Narratives are changing. You know, we've been fighting for years over these Confederate memorials, which are insane. I mean, it would be like Germany still having memorials to Hitler. I mean, it's crazy. These people fought against our country for slave power, and we still have monuments and flags. And we've been fighting that battle for years and years and years, and more have come down in the last month that have come down in the last, 100 years. And so that's happening. Policies are changing. My city's looking right now at moving police money into the public health office. These are changes a lot of us have been calling for years, and so that's hopeful. And it's really calling organizations to get real about what does it mean to focus on racial equity. A lot of groups have wanted to do the easy work of defining outcomes that way, but not the hard work. And the hard work is where it requires us to sacrifice, to give up things, to give up power, to give up resources, to really make changes that are longstanding. And I think I'm hopeful that more groups are recognizing the need to do that. America's fickle, so that could go away, and we have a big election in 4 months, which a lot's going to ride on. But I'm hopeful that the energy and organizing and marching and everything else is going to help us institute a lot more system change. And then again, I'm seeing these groups that are focusing on housing and hunger and education, really thinking of systems change in new ways. And my guess is there could be a lot of system changes made in the next year that are things people didn't think were possible before. Universal broadband, perhaps, or again, a lot of on public safety, on education, on housing. A lot of groups dealing with what does it mean to have the eviction policies we have in this environment? And what does that mean when we don't have this environment? And so that makes me hopeful, but I'm also cautious because America's America. But I think the collective work locally has been a great additive to that. And I should just also mention, in communities like mine, those collective impacts, all of them are applying a racial equity lens at every level of their work, and primarily trying to fill the gaps that they see universal solutions from the federal government are not meeting. And so a lot of focus on that as well.
So that's a great note of hope to end on, particularly for where we're at in Australia at the moment, the call to action. So thanks for joining us tonight, Paul, and have a good night.
Great, thank you, and great to be with you, and love the work you're all doing, and hope to get there again someday.
Yes, we hope so. Thanks.